are three friends who come to a river, and it's a beautiful day, but that scene is pierced by the cries of people in the water, in the river, crying out for help, in need of rescue. The three friends do what all of us do, especially those of us in healthcare. They jump right in to save those people, adults, children, the elderly. At first, the first friend, the strongest swimmer, says, I'm going to focus on those who are about to drown, just at the edge of the waterfall. Everybody applauds that decision. Of course, it makes total sense to rescue those about to drown, and everybody doubles up and says, let's rescue. People along the sides of the riverbank say that let's invest more resources, give that rescuer what he or she needs. But over time, it becomes clear that that's insufficient. People slip through the grasp of the rescuer. Clearly, something else is required. The second friend, actually, along there says, you know what, to make this easier, to make our success rate go up, let's coordinate the branches along the banks of the river here and create a raft so we can usher more people to safety, prevent people from going further downstream in need of rescue. We all applaud that. The success rate goes up, fewer people in need of downstream rescue, more people on the raft getting ushered to the riverbank. And yet, in the course of that work, the first friend and the second friend, the downstream rescuer, the raft builder, realize something is happening that they can't fully articulate, but they see it every day. The people keep coming. The success rate, while better, still isn't as good as they would want. People slip through. They start getting tired. They start getting a little jaded, perhaps. They start saying things like, to the people in the water, why don't you know how to swim? They start considering other rivers to jump out into, leaving maybe the purpose of rescuing. They start getting tired. But like a lot of us, they remain doubly committed to the work, and they remain heroically, nobly committed to rescuing, despite this strange phenomenon. Finally, they realize that they came with a third friend, and they don't see that third friend. They finally spot her. She's in the water. She's rescuing people as she's going, but she's swimming away from them, much further upstream. And they shout to her, where are you going? There are people here to save. They're in dismay. They're wondering why their third friend, a vital part of their team, is now leaving them. Turns out she's not leaving them. She's actually in the water again, helping people as she's going, and she shouts back to them, I'm going to find out who or what is throwing these people in the water. The reason I tell the story that way is because in the American healthcare workforce, and I think in the healthcare workforce in many parts of the country, of the world, we know that we have that first friend. We have that downstream rescuer, the trauma surgeon, the ICU nurse, the intensive case manager, the ER doctors, the oncologists. These are people that are vital, necessary parts of the workforce that we know we need. You want them when you're in dire straits. We're now in the phase of that second friend, the comprehensivist, the raft builder, the person who creates that primary care patient-centered medical home to usher more people to safety, to screen for certain issues, manage chronic diseases, make sure that those who are at risk of disease actually are prevented from becoming sicker. But we know increasingly now that while that's an important phenomenon right now in healthcare transformation in the US, the idea of the downstream rescuer and the raft builder, primary care comprehensivist, while we're in that phase, we know simply by looking at our patients and simply looking at what healthcare looks like on the ground every day, that model of the healthcare workforce is necessary but insufficient. What we have in the healthcare workforce right now, not nearly enough of, but what we do have certainly are that third friend. We have the upstreamist. The upstreamist's job is not to be the hero nurse or hero doctor or hero community health worker who is individually taking on rescuing people, but is instead, as many upstreamists before us have done, thinking about how to systematically understand and address the social determinants of health, where people live, where they work, and bring that understanding into the workforce and the workflows of clinical medicine, of healthcare,